My name is Oki Mek. I am the Chief Technology Officer for the Division of Acquisition at the Health and Human Services. Under the Accelerate program, we've really focused on what the business needs are, really focusing on what issues we're trying to solve. And really it has to tie to the agency's mission, vision, and value. And that's really focusing on transparency, interoperability, and the need to focus on data. The past 2 years alone, we have cultivated more data than our entire existence of mankind. So that's how much data we have currently. And we need to make sense of the data. And that's why data-driven project works. And it always needs to tie to the business initiative, the business needs. I always say there's no such thing as IT projects. There's a business project with IT components. I think it should follow the Accelerate standards of really focusing on incremental approach. And OMB's pushed this to really focus on proving a concept, a theory that you have, an idea that you have, by focusing on proof of concept, very small initiative, have something tangible that you can market to your workforce. And we do a lot of this through human-centered design. We have the requirements from federal acquisition regulations, but we really want to hear from the workforce, their pain points, what is their issues that they are dealing with. Because at the end of the day, we are IT professionals, but the workforce is really driving the bill. Our slogan is really that the IT workforce is actually building the system, not us. In terms of approaching IT modernization, I like to think of going back to the basic, really focusing on what is the issue. And the issue within any IT operation or any business process is that it is very paper-based. The first step is digitization of the data, building a good data taxonomy so you can analyze it. And then you need to share that data. And with administrative system, there's a need to share data and there's a need for transparency in the data. Human-centered design is really around getting the buy-in from the workforce. And I think that's very critical. You may have something great idea, but you can't sell it. It's not gonna work. So by doing human-centered design, we are allowing the workforce to build the system. We are just facilitating the build. We really focus on their pain points, their understanding of acquisition. Human-centered design also allow collaboration within the agency because CDC might be good at one area of the acquisition, CMS might be good in one area of the acquisition lifecycle. And in that sense of human-centered design, we are able to cultivate the knowledge and collaboration. And I truly believe that without collaboration, you cannot innovate. The key is collaboration and getting ideas and cultivating ideas in a holistic manner. Our focus is really to standardize the data, but decentralize the function. Keep in mind that at HHS, we are very decentralized. It's a big agency. It's about $1.3 trillion on annual operation. It's a very decentralized operation. We cannot force everyone to use the same function, the same software, but we could standardize the data and have transparency and traceability within the data, but decentralize the function so the workforce is able to use open source, COTS product, different development languages. So that gives you the flexibility of how you run IT, really to focusing on decoupling the data from the functionality, but on top of that, not just decoupling horizontally, but we are decoupling vertically. The traditional application is really one application, but what we're trying to do is decouple, slice up the application into small pieces using microservices. So instead of one application that satisfies, say, acquisition, we have 20 microservices that satisfy different functions of the acquisition lifecycle. I believe HHS is above the curve in terms of embracing the emerging technologies because we understand the current state of big data paradigm shift. There's a shift of dealing with data. There's a lot of data. There's a lot of works of still being done paper-based. But you have to evolve with the need of data, to focus on data and to get away from paper. And you have to introduce emerging tech because you can't make sense of all this data. A human cannot analyze everything. People fear of artificial intelligence, but I don't really want to call it artificial intelligence. I want to call it augmented intelligence. It helps lessen the burden of the professional of dealing with administrative burden, so they could actually focus on that task. I see the key to cybersecurity and in terms of modernization is really making cybersecurity simple. I think the biggest risk to cybersecurity is not the hackers, it's the users within the agency, the insider. If we make it easy and educate the workforce on how to use the system, how to safeguard the system, that is really the key. If cybersecurity is difficult to understand, to make sense, people tend to ignore cybersecurity. There's a lot of shift towards software as a service, platform as a service, infrastructure as a service. So you have many different platforms which speak different languages. But if you can make sense of the data, you could protect it better. Zero Trust model came out in 2010. It is I think it's a future model of cybersecurity. I believe that the microservice model facilitates Zero Trust model. Once you're inside, you don't have access to just the application, but you also have access to individual microservices. You shouldn't have access to the entire application. It's all you need to know. You need to know, and then you only need to know one specific portion of the component of the system, which is microservices. Yes, so we are working on a proof of concept to satisfy the continuous diagnostic mitigation program under Homeland Security. That program is focusing on continuous authority to operate, having a view of a continuous real-time of security posture. And on half of that is ATO, and the other half is audit log monitoring. What we're doing in the proof of concept is facilitating the audit logs using blockchain. What blockchain does is really just tracking the transactional logs. And the transactional log of a system is the network logs, the operating system logs, the application log, and the database logs. And if you're a system admin, you could actually manipulate the logs. If you have the key to the kingdom and you really understand the system, you could actually manipulate the logs. You could do something malicious and then cover your track, and then nobody would know about it. But if you could facilitate that using blockchain to capture the logs, transactional log, that's immutable, that has traceability, that's have transparency, that in itself protect the log, the one story of the truth of the logs. That will facilitate the logs that goes reported up from office to operating division to the department, to Homeland Security as a command center, which is shared across the federal agency as well as private sector as well. Having one story of the truth, which is the audit log, is key component to the CDM program.